NCLEX RN Exam Guide, your key to success in Canadian nursing licensure. The National Council Licensure Examination for Registered Nurses, NCLEX RN, is the definitive exam for obtaining nursing licensure in Ontario and throughout Canada. Administered by the College of Nurses of Ontario under standards set by the National Council of State Boards of Nursing, this critical assessment, also widely known as the Canadian Nursing Exam, RN Licensing Exam, or simply NCLEX, measures a nurse's readiness for safe and effective practice. Get your NCLEX RN exam study notes at coursetreelearning.com. NCLEX RN Exam Explained, Common Names and Usage. The NCLEX RN, officially the National Council Licensure Examination for Registered Nurses, is commonly referred to using various terms depending on the context in the region. Alternate names include the Nursing Board Exam, RN Qualifying Exam, Nurse Licensure Test, and Canadian Nursing Exam. Employers, healthcare institutions, educational providers, and provinces may use these different names interchangeably, highlighting the importance of recognizing all synonyms to maximize your study effectiveness and resource utilization. Importance of the NCLEX RN for your nursing career. Passing the NCLEX RN is mandatory for those who wish to practice nursing professionally in Canada. It confirms your competency, validates your ability to provide high-quality patient care, and is essential for gaining employment in the nursing field. Rigorous preparation is key to passing the exam the first time, allowing you to start your career promptly and confidently. Areas candidates find most challenging. Pharmacological knowledge. Candidate Jessica stated, "I struggled significantly with the breadth of medication-related questions, especially dosage calculations, and understanding complex drug interactions. Patient care prioritization. Deciding which patient needs immediate attention was particularly difficult," mentioned Alex. "It requires clinical intuition combined with solid nursing judgment." Physiological responses. "Applying my theoretical knowledge practically to diverse patient scenarios tested my critical thinking immensely," according to Angeli. Expert perspective. Insights from Dr. Michael Thompson, nursing professor, University of Ottawa. Dr. Michael Thompson stresses practical understanding over pure theory. "Initially, like many students, I focused heavily on memorization for my NCLEX RN preparation. However, the exam itself demands critical thinking and real-world application. It wasn't until I began practicing with realistic clinical scenarios that my comprehension deepened significantly." Practical application of knowledge is what truly differentiates successful candidates. Learn more from Dr. Thompson. NCLEX RN exam details and registration process. The NCLEX RN exam includes 75 to 145 questions utilizing computer adaptive testing, SETT technology. Candidates have 5 hours to complete the exam, including scheduled breaks. To register, apply for approval through your provincial regulatory body, such as CNO. Register with Pearson VUE after approval. Schedule your exam once you receive your authorization to test ATT. Essential study materials for NCLEX RN success. Structured lecture notes. Comprehensive notes covering all critical nursing concepts and exam objectives, facilitating organized and efficient study sessions. NCLEX RN practice questions. Extensive question banks featuring authentic exam questions and detailed explanations, regularly updated to reflect current standards. Revision flashcards. Convenient flashcards for quick and effective revision, promoting active recall and retention of vital information. NCLEX RN sample questions. A nurse notes edema in a patient with congestive heart failure. Which action is most appropriate? A. Administer diuretics. B. Encourage fluid intake. C. Lower the legs. D. Restrict dietary protein. Correct answer, A. Which vaccine is contraindicated during pregnancy? A. Influenza. B. MMR. C. Hepatitis B. D. Tetanus. Correct answer, B. A patient complains of chest pain. The first priority of nursing intervention is A. Administer analgesics. B. Provide oxygen. C. Notify physician. D. Obtain ECG. Correct answer. B. A nurse must administer a medication intramuscularly. Which site is most appropriate for an adult patient? A. Deltoid. B. Ventrogluteal. C. Vastus lateralis. D. Dorsogluteal. Correct answer. B. Which electrolyte imbalance is associated with severe vomiting? A. Hyperkalemia. B. Hyponatremia. C. Hypokalemia. D. Hypernatremia. Correct answer. C. What is the priority nursing intervention for a patient experiencing a seizure? A. Restrain the patient. B. Insert an airway device. C. Place patient on their side. D. Administer oxygen immediately. Correct answer. C. The nurse knows which symptom indicates hypoglycemia? A. Polyuria. B. Fruity breath. C. Sweating. D. Thirst. Correct answer. C. Which medication should a nurse anticipate for treating opioid overdose? A. Naloxone. B. Morphine. C. Diazepam. D. Atropine. Correct answer. A. A nurse is caring for a client post-operatively. The most common early sign of infection is A. Pain. B. Swelling. C. Fever. D. Redness. Correct answer. C. What precaution is essential for a patient with tuberculosis? A. Contact isolation. B. Airborne isolation. C. Droplet precautions. D. Standard precautions. Correct answer. B. What is a common symptom of left-sided heart failure? A. Peripheral edema. B. Ascites. C. Dyspnea. D. Hepatomegaly. Correct answer. C. Which intervention is most effective in preventing pressure ulcers in bedridden patients? A. Regular repositioning. B. Frequent bathing. C. High carbohydrate diet. D. Increasing fluid intake. Correct answer. A. Which assessment finding indicates adequate tissue perfusion after a cast application? A. Pale skin. B. Weak pulses. C. Warm skin temperature. D. Numbness and tingling. Correct answer. C. What is the primary action when encountering a fire in a healthcare facility? A. Extinguish the fire. B. Evacuate the patients immediately. C. Sound the fire alarm. D. Call the fire department. Correct answer. C. Which blood type is considered the universal donor? A. AB positive. B. O negative. C. A negative. D. B positive. Correct answer. B. What dietary recommendation is appropriate for a patient with hypertension? A. Increase sodium intake. B. Reduce potassium intake. C. Increase calcium intake. D. Restrict sodium intake. Correct answer. D. A patient receiving chemotherapy develops neutropenia. What is the highest priority nursing intervention? A. Monitor temperature regularly. B. Increase fresh fruits and vegetables. C. Allow visits from friends and family. D. Encourage walking in crowded areas. Correct answer. A. Which laboratory result should alert the nurse to possible dehydration? A. Decreased hematocrit. B. Increased hematocrit. C. Decreased urine-specific gravity. D. Increased sodium levels. Correct answer. B. A patient with COPD requires oxygen therapy. What is the appropriate oxygen delivery method? A. Non-rebreather mask. B. Simple mask. C. Nasal cannula. D. Face tent. Correct answer. C. Which psychological response is typical immediately after a patient learns of a serious diagnosis? A. Acceptance. B. Bargaining. C. Denial. D. Depression. Correct answer. C. Career opportunities after passing the NCLEX RN. Passing the NCLEX RN significantly enhances your nursing career prospects, leading to roles in hospitals, clinics, community healthcare centers, education, research, and specialized care units. Demand for licensed nurses remains robust across Canada, promising competitive salaries and job security. Frequently asked questions, FAQs, about the NCLEX RN. Can I retake the NCLEX RN if I fail? Yes, retakes are allowed. typically after a 45-day waiting period, but limits apply per year. When will results be available? Official results are usually provided within 6 weeks, with unofficial, quick results available in some locations. What identification is required on test day? A valid government-issued ID matching your ATT is mandatory. Are testing accommodations available? Yes, accommodations are provided with appropriate documentation and prior request. Practical application, intravenous therapy procedure. An essential nursing skill assessed by the NCLEX RN is administering intravenous IV therapy. The nurse begins by verifying physician orders and correctly identifying the patient. Selecting an appropriate IV catheter based on therapy duration and patient condition, the nurse prepares the insertion site using sterile techniques. The catheter is inserted into a suitable vein, secured with a sterile adhesive dressing, and connected to the prescribed IV solution via sterile tubing. The flow rate is then accurately adjusted according to medical instructions. Continuous monitoring of the patient for complications like infiltration or phlebitis. Thorough documentation of the procedure and patient assessment throughout are critical for successful IV therapy administration. Career opportunities after passing the NCLEX RN. Passing the NCLEX RN significantly enhances your nursing career prospects, leading to roles in hospitals, clinics, community healthcare centers, education, research, and specialized care units. Demand for licensed nurses remains robust across Canada, promising competitive salaries and job security. Take action now to ace your NCLEX RN. Prepare effectively and ensure your nursing licensure success.